Basically, we do it very clinically. So it's basically the same story. Doctor having whitish discharge. It's not really, it doesn't smell bad really, but I have some itch or some burning, just to confirm it, because most cases we just treat them with that, but of course we do a pelvic exam if we can, and it's recommended to take a sample and just do a smear so we can watch this under the microscope, and then we confirm it when we see the yeast, basically in the slide that we're watching under the microscope, which you can see there in the upper right corner. How do we treat it? The treatment, fortunately, it's very, very easy. And as I mentioned before, this is very, very common. I mentioned 3 out of 4 women will have it. And usually this is something that happens more than once, because there's so many factors that are related to it that sometimes it's difficult to control it. Not necessarily hygiene, it's always the case. Actually, it's almost never the case. We use diflucan, which is fluconazole, which is an antifungal, similar to like antibiotics that work on bacteria. This works on fungus. You can also have antifungal medication in creams or gels, which we also use. We prefer oral antifungals because it's easier and it takes usually 1 pill. In the other hand, creams, you have to use them for 3 days, some others you have to use it for 7 days. So it's easier for the patient not to follow the whole treatment. So we prefer oral, but topical can also be used. Of course, we also recommend probiotics, not only for this, but you will also see that for bacterial vaginosis, which replenish the vagina of those good bacteria. You can get it in yogurt or just buy them in like pills or capsules. You can buy them, they're over the counter. And the last thing, the recommendation is you have to actually take care of some soaps or products that you might be using to for your personal hygiene, especially in the vulvar and vaginal area. We do not recommend anything that has color or perfume to use there, because that changes the pH. Basically, we would recommend a white, odorless soap to use in that area. And even when it sounds surprising, not even the products that they're commercially advertised as feminine soaps or anything like that, we do not recommend them. So just regular odorless and colorless soap is just all right for that part. You can use the normal soap for the rest of your body. Because actually trying to help, women say, oh, but I wash, I'm very careful with my hygiene, but maybe the problem is that you're not using the right soap. So that's one of the